Hi, good afternoon and welcome to the Able Exchange. I'm here today with Dr. Rehab. Dr. Rehab, welcome to Able Exchange. How are you?
I'm good. Thank you, Denise.
Excellent.
All is good.
Thank you for being here. So can you introduce yourself and tell us about your current role?
My name is Rehab Zaytoun. Rehab is a very Arabic name, so the English pronunciation is usually a little bit funny. It's Rehab. If you're unfamiliar with the Arabic language, you'll be pronouncing it this way, which is a bit funny because this is kind of my profession, which is rehabilitation. Yes. I'm originally a medical doctor. I'm graduated from medical school. I specialized in Phoniatrics. Phoniatrics is the medical subspecialty of speech and language pathology. So what we studied in the master's and the medical doctorate is a little bit of psychology, psychiatry, in addition to swallowing, voice, and communication disorders. When I graduated and after I graduated, I had the privilege and the pleasure to work with children with severe needs. Mm-hmm. This took me to a realm that I wasn't familiar with before, which is muscle-based speech and feeding disorders. One thing led to another. I continued with my studies in the USA and with many training entities there who are specialized in muscle-based feeding and speech disorders. In addition to this, I have a vast experience with social communication disorders and language-based academic disorders as well. So this led to vast learning in different, realms and fortes. And eventually I got to know TalkTools, which is a well-known institute in the United States of America that specializes in feeding and speech. I started my journey with them something like 10 years ago. First attending their trainings, then being trained by them on one-to-one basis until I became their instructor in the Middle East region. Okay. So it's been quite a journey.
Absolutely. It sounds like a varied and really rich journey as well. Is it fair to say that TalkTools was a pivotal moment, becoming involved with them, that honed your interest in oral placement therapy?
Big times. It was an eye-opening because they kind of gave me answers to many things I struggled with. Mm-hmm. I believe any person who works in the field of rehabilitation will go home every day with some questions. Mm-hmm. How can I help? Why if this child is not progressing? What can I add to their journey? How can I improve their functionality and their functional communication? Attending these trainings and getting to know them, and back then nobody knew anything about them in the region. Yeah. Nobody knew anything, literally. You will look at a child who doesn't eat or drool and you would think about behavior. He's drooling because he's misbehaving, he's trying to skip a task, or ask him to swallow, ask him to wipe his mouth. Oh, he's not eating because he's not hungry, he's not eating because he is a spoiled brat, and this is a common thing to label children with feeding difficulties. Eventually, getting to know that there are other dimensions and other, ways to look at things was extremely life-changing for me.
Fantastic. Thank you. And so we have parents listening today. We have clinicians, therapists, and people within the sector generally. And can we rewind a moment and define what do we mean by oral placement therapy and feeding issues?
Okay. Well, this is quite easy for me now, after all these years learning about it. Let me simplify it. You're talking about muscles, sets of muscles connected together. If these muscles are not working properly the way that they should work, children will not be able to imitate the sounds. We are created as human beings to learn and acquire speech sounds by imitation. And we learn skills, especially movement skills, by theories of motor learning. So you move your lips together, they make a sound, you use your voice box, you make a sound, the motor learning pieces click together, and you realize, wow, I can move these sets of muscles to make this sound, and when I make this sound, it makes a change in the world around me. Mom will look at me, she'll come running and answering my needs. Quite a discovery. Then things will click in. Every day, I'm making a new sound. Mom is attaching a meaning to this sound, and I know how to use my instrument and connect the puzzle pieces together to make these different sets of words and sounds. This is if we're lucky and we're born with innate abilities to connect the dots and go through the process of motor learning without external help. If there's any breakdown in this process, this is going to negatively impact this outcome. Or in simple words, I can't use these articulators or this instrument to produce these speech sounds. So the child will not be able to look at you and imitate what you're saying. You'll keep repeating it over and over, and they are not able to establish this connection. This is exactly where oral placement therapy comes in. It's facilitating the motor learning and the muscle movement, either by using food as a therapy item or using some simple yet effective tools to help the muscles achieve these outcomes. This achievement can be helpful and is helpful for both speech and feeding, because obviously we make the speech sounds and we eat using the same sets of muscles.
Amazing. So is it a discipline within speech therapy then, essentially?
Yes, absolutely. It's a discipline within speech therapy, and we keep telling people that it's not exactly a new invention. It's just putting together an intervention approach that works within a hierarchy that both therapists and parents can easily apply. You have a starting point and you have an end point where you can easily implement with your clients, either children or even adults.
Amazing, thank you. And what's the most common question a parent would ask you if they come to you then for support?
Well, it depends. If they are coming for a feeding concern, the question will be, I want my child to chew on his food. Will he be able to eat? Usually, this is a journey, and eventually we make a lot of progress with the children that we see and we work with. The other common question will be, my child is not talking. Will they be able to talk? And this is usually a more complex question. But these are some of the most common questions parents ask us all the time. And we definitely, regardless of the child's profile and current level, we tell them we're going to achieve some progress, and this is what really matters. And we're going to achieve some functionality, and this is what really matters. So it's a journey. Let's walk it together.
Amazing. What's one thing that you wish parents knew before they came to you?
Definitely early intervention and developmental milestones. This is life-changing. If there's one thing that I can talk about endlessly, will be intervening as early as possible, play with your child, communicate with your child, because this can literally change their brain and how the brain works.
Amazing. And so would this take place as part of a broad multidisciplinary assessment if a parent comes to you with this concern?
Absolutely, because this is what I keep telling the parents, and this is why answering a question that, like, I want my child to eat, or how can my child eat, or how can my child speak, are very difficult, because they involve the entire body. They involve the cognition, the intellectual abilities, the motor abilities, the sensory abilities, the behavior part on top of all this, in addition to the speech and language pieces that we work on together.
Amazing, thank you. And so what would be some of the early signs that you can hide, maybe 2 or 3 early signs or red flags that would indicate a child is likely to need support in this area?
Well, my red flags are early ones. If a parent will pay attention to the way their child communicates since birth, because this is something that people are unaware of. Communication starts at birth.
Right.
It doesn't start at the age of 2 or the age of 3. If the child calms down after they are fed, if they are showing some hunger signs, if they are satisfied when they are feeding, either breastfeeding or bottle feeding, if it's a pleasant experience for both the mother and the child, if they start to make eye contact and use social smile at the age of 3 months and sometimes earlier, if they start pointing and using gesture, laugh, calm down early on, they explore toys at the age of 6 to 8 months, and they are following their motor developmental milestones. They attend to sound, they respond to their names at this early age.
Yeah.
I would say the first 3 years is the year of milestones and paying close attention how the child is interacting with the world and with the parents. And absolutely no screens, absolutely no passive screens. I think the terminology passive screens, I'm not quite sure if it's used or not. It should be normalized, because children, even if they are not directly sitting in front of the screen, they are exposed to it when the mommies or daddies holding the phones while they are dealing with them, which is kind of passive screen exposure. So if we can pay attention to all these milestones, we can certainly prevent or at least predict many of the neurodevelopmental disorders.
Amazing, thank you. So being really aware of those developmental milestones, is there anywhere that you would point to for general parent support beyond coming to a centre like ABLE? Maybe some social media channels where parents can just educate themselves a bit further on these issues?
100%. In ABLE UK, we're very keen on educating parents and spreading awareness about these red flags and milestones, because it will make our life easier to intervene early, because you can definitely change the way the brain works.
Amazing, thank you. And what are some things that parents could safely do at home outside of therapy? And are there any things that they really should avoid?
Play. Get yourself educated and trained on how to play and interact with your child. This is going to be an amazing journey if you're both going to enjoy it. And definitely avoid screens, at least in the first 3 years of life.
Okay, great. So going back to your role then, because it's super varied, even now you're traveling to lots of places. I believe you're a lecturer as well in the University of Cairo.
Yes.
Amazing.
Medical school, yes. Fayoum University. Yes.
Thank you. So maybe tell us a little bit about what does your day-to-day look like typically?
Wow. This differs as per the timing of the year and my whereabouts. In Cairo, my usual day will start between 7 to 8. I usually work out early in the morning, then go to the clinic or the university, see my clients, and then do some online lecturing, usually between 6 p.m. to 8 p.m. And that's the day for me. Wow. If I'm doing some traveling, which is very frequent because I do see clients around the world, and I lecture and train internationally. So it depends, but usually, again, I might skip the workout part in the morning if I'm abroad, or I might do something quick to regulate myself and have a good start for the day. Then I'm lecturing usually 9 to 4, and that's it, So this is usually what I do during work days.
A busy lady, and I understand that you're working here at ABLE both in a consultant capacity and supervising specific cases, and also you're doing some mentoring with the whole speech department.
Absolutely, yes, because like I've mentioned, we're here in ABLE UK, we're dealing with different profiles from the little ones to the older ones. So it depends. Some of them might come with social, emotional difficulties in communication, and obviously this is going to affect their school life and academic achievements. In addition to the little ones who present with speech communication issues, and we have a big clinic attributed only for and specialized only in the feeding concerns. And Abel's forte is being a multidisciplinary center. So it's literally a dream coming true to have a child seeing an OT and sensory professionals. So they are regulated, ready to work. They go to the speech or the feeding session, ready to sit and work on their mouth muscles. So working in the mouth is not an area that you can take separately from everything else. And this is what we keep educating people about. You need to be regulated in a good place so you can sit and do something really challenging, like chewing on a piece of food that you're not able to handle in everyday life.
Okay, great. So families are benefiting hugely from your experience and your presence here at Able, but the staff are also learning loads, which is wonderful. What skills or knowledge matter most for any therapist thinking about moving into this specialism?
I believe there are many personal factors that the person who is willing to work in the field of rehabilitation should possess. Empathy on top of all, definitely, and they have to be eager to learn more and invest in learning, because this is a very dynamic field. You need to work on yourself and develop peer skills every single day. I believe, and you should be flexible. Flexibility is a very important trait as well.
Great, thank you. Have there been any aha moments that you've experienced with the team that maybe this a moment of like a light bulb moment for them as you've educated them in this area?
Yes, I believe every training or a mentoring session, when they come running with a smile, I did this with this little child and it worked. Oh, I tried this technique and he started to say this. Or yeah, I tried this and he was able to acquire this new food. So these are usually the aha moments that make it worth, the effort and the ongoing work.
Good. And what would you say to what should therapists remember on really hard days?
Oh, they are making a change in the child's life and their families. This can impact many humans on so many profound levels.
Beautiful, thank you. Okay, so what developments are happening in the field now broadly that really excite you?
I believe there's a huge shift in the field of rehabilitation and interventions in terms of not dealing with a child like an object, that we want them to do this and we want them to do that. It's thinking about children, and this might be common sense, but in the same time it is not. Thinking about children as human beings with needs, wants, emotions, taking into consideration the co-regulation, emotional piece, which is very important.
I'm really happy to hear that, because I think that's true of education more broadly as well, taking a much more holistic view of educating the whole child and focusing on their strengths, not only deficits, which is hugely important in a therapeutic context.
Yes, absolutely.
Great. Thank you. What keeps you up at night professionally?
I think achieving progress, especially with children who need a lot of help. Because certainly this is life-changing for the parents and for the children themselves.
Can you give us an example, Dr. Rehab, of a case without obviously naming anyone, but can you give us a scenario that you've experienced where you've seen that progress and it's been life-changing for you and the family?
Yes, I can absolutely recall many text messages, emails, and sometimes indirect messages, because when we started working in this field, social media wasn't as strong as it is today. So we basically got clients by the word of mouth. So I will have a parent coming in and saying, my friend, the mother of this particular child, referred me to you, saying that you changed her life. Wow. Even if I didn't hear it directly on that particular moment from the mother itself, but usually this is the, life-changing moments that make us eager and striving to serve and perfect what we're doing more. Because I keep telling people communication, eating, as simple as they might sound, but they are very complex in nature. And they are, especially communication, this is the specific miracle of human beings, like the complexity of the language, the complexity of the cognitive skills. This what makes us, who we are. So in order to bridge the breakdowns, it could be very challenging for everyone. So saying that you changed my life, or you helped my child, or you helped my child talk, this is really, really life-changing moments for me. Yeah.
Wonderful. Thank you for sharing with us. And what's one thing, we talked about the importance of continuing professional learning, which obviously happens here all the time and in the work that you do more broadly. What's one thing that you're personally currently reading or learning about at the moment?
Learning about helping children with severe motor disabilities, on learning how to communicate using AAC devices, because I think AAC is a big thing that is happening in the world of rehabilitation now.
Can you tell us a bit more about what that means for anyone?
Alternative augmentative communication.
Okay, great.
Yeah. We're very holistic in our intervention generally. We're very holistic in the way we deal with children, and we're very keen on empowering communication. So it might not be necessarily verbal, but it can be via device or a communication medium to facilitate expression and communicating thoughts and feelings. Okay. So this is what I'm currently working on.
Fantastic.
Yes.
Thank you. Thank you so much.
And you're going to be back joining us, I think, later on this semester in May. Wonderful. So let's encourage our listeners then to send any questions that they might have. Link for the email address is below, so please email us and ask Dr. Rehab anything that you would like to know, and we'll answer it on our next session with you. Dr. Rehab, thank you so much for your time today.
I'm really pleasure to meet you, and bye-bye. I've enjoyed it. Thanks so much. Thank you for having me.